Yes, our viewers, you're most welcome to our channel where health matters. Today, we want to talk about prevention, we want to talk about treatment, we want to talk about how we can notice or identify ourselves in the health manner. It's always good to be equipped. It's always good to have the knowledge with you as you go into a health center or a healthcare facility. You should know that I think I'm suffering of this. You should know that with this, probably this is what I expect from the medical professional or from the person who I'm going to seek aid from. Because always, if you go to somebody to seek help and you do not have an idea of how the situation is like, you're most likely to be handled anyway or anyhow, and you will be contented. But if you know that with this or that, I at least think of this or that, then from the start you will be comfortable and you will be uh, relaxed that at least everything is going to be okay. Right. Today, let's look at UTI in particular. What is UTI? UTI is a urinary tract infection, and there are a number of diseases that fall under UTI, and we shall mention a few of them, and then the rest will come in other videos that we shall make and upload for our viewers to benefit, for our subscribers to benefit. We have what we call gonorrhea. But before we proceed with gonorrhea, there is also something that I want to make clear to our viewers. When we talk about an STD or STDs are more like the UTIs. STDs are sexually transmitted diseases, and the UTI can be sexually transmitted or can be got through the bathrooms and urinals and toilet. So they both affect the same organs. They both affect the same organs. They do affect the urethra, the vaginal tract, the fallopian tubes, all that. And at times it is one bacteria that can become a problem, or there are a number of bacteria that can cause UTI. UTIs are basically bacterial infections. They are basically bacterial infections, though we have other fungal infections, for example, Candida. So when we are looking at a UTI vis-a-vis an STD, you should always have some basic signs that will come, or that you will feel, or that your friend or partner or your family member or your child will tell you, and you'll basically know that this is this. And as you go into a health facility, please know that I guess this or that. To other countries where we still have access that you can come to a pharmacy and ask a disease of your choice, or walk into a clinic and come into a health facility and ask for a drug of your choice, a medicine of your choice, and only get guided by the prescription. You have a higher chances of treating yourself a urinary tract infection or a sexually transmitted disease. Okay. 1. Let's look at, like I said, we have gonorrhea. Gonorrhea is typically a sexually transmitted disease. Most, say 95% of gonorrhea cases are transmitted through sexual intercourse. And gonorrhea has a variety of signs. 1, you will always have painful maturation. 2, in late stages of gonorrhea, you will have penile discharge or urethral discharge. And this discharge of gonorrhea has a foul smell, and it can be greenish or kind of brownish, depending on the state. In late stage, it can be brownish. In early stage, is greenish. In very early stage, the discharge is pus-like. And gonorrhea, as we've talked about, the sexual transmitted diseases, all having a similarity with a UTI, simply because sexual organs make the urinary tract system, and this includes the urethral and the penile organs, or the vagina and the vulval tract, or the underlying organs. So when we are looking at a UTI or gonorrhea, so these are general signs of a UTI, that someone will complain of a burning urine, someone will complain of a painful urine, someone will complain of an abnormal pus discharge or abnormal discharge, somebody will complain of a lower abdominal pain. Okay, a lower abdominal pain. And in the later stage, it can as well bring in back pain. Okay, so this is what we normally categorize as a UTI, or part of a sexually transmitted disease. There are questions that a medic is going to ask you that can easily help him diagnose your infection. And these questions can be, if you have discharge, what is the color of discharge? Because most of all these UTIs will cause you a painful maturation, will cause you a lower abdominal pain, and will cause you a discharge at times. So if there is a discharge, a medic will ask you, that what is the color of this discharge? A medic will ask you, how is it? Is it having a foul smell? Does it smell the discharge? Normally, there are other discharges, say like in Candida. Candida is a fungal infection. It affects both the urinary tract system and it can affect the oral, the mouth, okay, we can call it the oral cavity, right? It can affect the oral cavity, it can affect the urinary tract system. So Candida is specifically having a sign of a white discharge that will help you identify that this inconvenience that I have, and this is common in ladies, you produce a white milky discharge that at times is sticky and heavy, it looks like a spoiled milk. That is Candida. And if you go to a hospital normally or a health center, they will tell you, okay, let's do a urinalysis. Fine, it's good to do a urinalysis, but as well a medic can treat you without having a urinalysis, because basic signs and basing on your interaction with him, he can easily identify that this is a UTI. And if he asks a more precise question about the color of discharge and is white, then it's basically a Candida infection. Okay, now that is Candida. And how do we treat Candida? Being a fungal infection, we have fungal medicine that we have antifungals that we use. And for Candida, the most safe and the most effective medicine is fluconazole and guaianazole. And it's always good to have a combination of these two. Take the fluconazole caps or tablets orally and then insert the guaianazole cream or guaianazole pessaries vaginally, and then your partner should take fluconazole tablets or capsules. Fluconazole is normally made or packed or produced in milligrams of 200 mostly, and that means you will have to take one capsule or one tablet of a 200 milligram package or packing daily for a period of 21 days if the infection has taken long with you. But if it's a short and it's the first time, you only need to take it for a period of 14 days, and that is all. So for the ladies, insert the pessaries or use the cream guaianazole. There are other creams, like we have the Candida, we have the other tablets that as well we can use, but though they are not as effective as fluconazole and they are not as effective as the guaianazole cream, because people will tell you that, okay, you can go with ketoconazole. Well, ketoconazole is also good antifungal, but ketoconazole It's a bit weak when we come to candida. And most of our people suffer candida, and they suffer it repeatedly. So it's always good when it comes to candida, you attack it by the best and the most strong antibiotic available. Antifungal available. So that is for the case of candida. And we said that candida can easily be identified when someone is complaining of the basic signs of UTI. And the basic signs of the UTI, we've talked about lower abdominal pain, painful micturition, itching of the vagina, and then we've talked of lower abdominal pain and the backache, So mostly when you have a white discharge, and it's cardio, and you put like for the ladies, you put your fingers deep into your vagina as you're cleaning it, and then you have that whitish discharge on it, that is basically candida. And you don't need to go and do a test to treat candida. No. Just buy fluconazole pessaries or gynazole pessaries or gynazole cream, and then get fluconazole capsules or tablets and take. Candida will have gone. Okay, and for your partner, let him take the capsules of fluconazole, because at times the men harbor the disease but they don't have the signs. That is with candida. Then we take a look at gonorrhea. With gonorrhea, we already said that these basic signs, apart from the whitish discharge, the basic signs of the UTI will be there. Then on top of that, you will need, at times when there is that greenish discharge, that pus-like discharge, that means is a gonorrhea cropping up. That's foul smell discharge. And with that, how do we handle it? Gonorrhea is basically a bacterial infection, and it is caused by gonorrhea bacteria called gonococci or Neisseria gonococci. So with that, we shall need an antibiotic, and there are good antibiotics of choice that we will use without need of doing a urinalysis, and you will be okay. And you go to a medic, and you don't need to ask him, and it asks you of a UTI, you tell him, no, I only and only want ABC. Okay, so for the case of gonorrhea, we shall discuss around 4 or 5 treatments, and I will tell you a combination that is very perfect for gonorrhea. 1, we shall need azithromycin plus doxycycline. When you use azithromycin, 500 milligram OD or once a day for a period of 6 days, and use doxycycline 100 milligram BD for the same number of days, you will say bye-bye. Bye-bye gonorrhea. Okay? Bye-bye gonorrhea. But also what you have to know, that in case you have some multiple partners and only one complains of these signs, do not only treat one, treat the companion also. Treat yourself, treat the other companion, and so for that we've talked about an antibiotic by the names of azithromycin combined with doxy. We can still use ciprofloxacin combined with doxy. We can still use metronidazole combined with doxycycline. Okay, we can still use fluoxycyline combined with doxycycline. Okay, so all these are 4-5 different prescriptions that we can use to treat a gonorrhea infection. So if the worst comes to the worst, then go or get yourself injected. Okay, but always, if you identify something early and you get early treatment, you will not need to be injected. All right, so for today, let's stop there, and then we shall add the rest of the information next time as you enjoy. Treat yourself at home. Thank you. I'm Emmanuel Olobo, and I welcome you to this channel.